Hello everybody, welcome to yet another session of Medical Health Talks brought to you by Med Expo Africa. So today we're going to talk about why Ugandans seek medical care abroad. I'm joined here by Dr. Fiona. I'm going to let her introduce herself in detail.
Hi everyone, I'm called Dr. Fiona. And I'm excited to have this conversation because I think it's important for us to talk about it. It's one of those things everyone is like, why are Ugandans going abroad? And we're going to delve a little deeper into it in a few minutes.
Okay.
Yeah.
So Dr. Fiona, why do Ugandans actually go abroad for medical care? Because it seems like it's something that is growing lately.
Yes.
Like most people actually prefer to seek medical care abroad. So let's dive into why they actually prefer to seek medical care abroad. What is so special?
There's so many reasons. There are really many reasons.
Yeah.
But one of them, in my opinion, is there's a perceived lack of expertise back home. You know, Ugandans, even if you told the Ugandan this gynecologist can perform this procedure, they already have a bias towards the healthcare system. And I also don't blame them because I think what they've seen in media that's usually reported is the negatives, you know, what has gone wrong, what could go wrong. And so because of that, someone might be a bit skeptical to, like, especially if they have a very major surgery and they're feeling like 8 hours with this doctor that I've heard bad things about, the person might prefer to spend their money if they have it and go abroad and maybe get the expert that they've probably heard about or they feel is better than the Ugandan doctor. So that's one of the reasons. And then there's just also the whole waiting times, because there are times when you have a procedure and then maybe they tell you the only available time in the doctor's schedule is maybe 3 months later. And you feel like your life is on the line, you know? And that's why you see very many Ugandans prefer to, let's say, put out a call, let people contribute money for me so that I can go abroad and get this procedure within maybe a month's time. So because of that waiting time that sometimes is experienced also because of maybe the workforce, or you find that this specialist is probably the only specialist that can perform that procedure, it might make someone prefer to go abroad and just cut on that waiting time so that they get maybe the procedure in a shorter time as opposed to waiting for so long.
Actually, that even tends to backfire on them because you realize that appointments with these specialists actually takes longer. So I can tell you, no, you come, and then they go, they spend a lot of money, something that would have, a procedure would have been done here much quicker, you understand? But because they believe, no, I think it will be better for me to wait. And now, in consequence, they end up getting more complications because they have decided to take themselves abroad. And actually, the waiting time that they perceived would have been short actually ends up being longer.
Because also, they can give you an appointment, but when you get there, they have to check and make sure you're fit for maybe the surgery or for the procedure. So if you're not fit, they'll still tell you, wait for that 3 months and become fit before you do that procedure. So.
Actually, very true. And I don't blame Ugandans in that some people actually, they have that perceived lack of expertise. It may be perceived, and it also may be due to an experience they had with their relative, with even themselves. So they believe that maybe if I actually go and seek medical care abroad, it will be better for me or better for my relative, you know, so that they do not get whatever complications they got earlier, or maybe they probably asked them for too much money, or they got some infection after. So because of this perceived lack of experience, of expertise, and or coupled with the experiences they had before, they decide to actually seek medical care abroad.
And also, some conditions seem very final, because if a doctor comes and tells you this one, you know, sometimes you just want to get a second opinion. Because someone can tell you this condition, even if we do the prognosis or the likelihood of you getting better is very unlikely. It will just improve your quality of life, but you won't be better. So someone might go abroad because they've heard of a different expert and they want another opinion from the expert to just counteract or to prove this person's opinion that is back home. So that's why some of them decide to go abroad and get those second opinions.
Okay.
Yeah.
And unfortunately, by the time people go abroad, sometimes it's too late for them. So, yes, you want to go abroad and get medical care, but you will reach there and then they'll say, you know what, we can't really do much for you. So I don't know. Honestly, it's a two-way thing. It's good, it's bad. You don't know, it's like try and error. It's a try and error for them. Then maybe also, we also get referrals from different local doctors. They'll be like, you know what, I think you'll get better medical care at Aga Khan Hospital in Kenya. So most people, they end up going to Aga Khan Hospital.
Or go to India.
Yeah, to India, especially India. Yeah, people like to go to India for their medical care because they've been referred by the local doctor saying, you know what, if you go and see such and such a specialist in such and such a country, I think you have a better prognosis, and better quality of life at the end of the day.
And I also think in some situations, the doctors are referring not because they can't perform, but because they don't have the right equipment.
Exactly.
Because there are certain procedures that need a certain level of sterility. There should be no germs in play. So even if the doctor could perform it, because of that, they are likely to say, you know what, let me refer you to a place that has better facilities, or maybe that can provide this health care in the standard that is required for your health. So that's why some doctors will refer you so that you go and then get the health care from abroad.
Very true. Actually, some Ugandans believe that when they get medical care abroad, they will actually experience a holistic approach towards their care. Actually, they believe that here in Uganda, we do not look at things like supportive care after surgery, for example, or look at the psychology of the disease. How is it making me feel? How is it affecting my family? So they believe that when they get medical care abroad, they will be able to access all these. So basically, they go abroad to get holistic care from the different medical facilities abroad. Yeah.
And we've also watched movies, because when you watch those movies and series, these medical TV shows, you're just seeing the standard that's being displayed, and then you walk into a hospital in Uganda and you feel like, it means they can do better than this. So it just makes you feel like, let me try my luck abroad, because you're expecting better, because you're seeing a patient walks in, maybe a patient that's got an accident, and they're doing all these tests, and yet you, when you got it, you didn't have all these tests getting done. So probably one of the reasons why they go. And then also one other thing that I think is the cultural preferences, because I have a friend that told me her husband prefers to have had give birth abroad, because he believes that their cultural beliefs are more they relate more than the ones that are here, because he didn't like how Ugandan doctors touch the women and stuff like that. So someone might have their cultural belief and they're like, I don't like how these Ugandan doctors are dealing with this particular person, this woman, this child.
Especially the Muslims.
Yes.
So they be like, can I get treated by a female doctor? And that doctor is not around. So they seek to prefer and go and seek medical care in Dubai, where it's only female doctors who treat female patients. And even these planned kids, they have their insurance coverage. So they'll be like, okay, why am I seeking perceived substandard medical care in Uganda if I can actually access better care abroad? So that could also be one of the reasons why they actually decide to seek medical care abroad. There
are so many reasons. There are really so many reasons, because also there's the issue of specialized treatment, because every medical profession has its specialists. You know, for example, you want to see a neurologist, or you want to see a child psychiatrist, and you could look around Uganda and maybe the one that you want to see is not available in the time you want to see. So you could go in search of a certain specialist for a particular procedure. So there are times when Ugandans just have to go abroad, even if they didn't want to go, But we cannot overlook the exorbitant prices, the money that comes with it, because it's really not cheap. We've all seen those, flyers going around. People are looking for money to go abroad. And, and the reason why we're having this health literacy campaign is also to help people know that some of those services are here.
They're actually here.
Because some people are going because they do not know. They don't know that these services are here. They do not know. Some people will even be surprised that you can do sickle cell screening.
Yeah.
And you're like, okay, these services are here. They are present.
Sickle cell screening.
Yeah. So there's just, I think more awareness needs to also be done. People have to know more about what's available and the cost ranges, so that when they make their decisions, they are informed by knowledge and also what's on the market. Yeah.
So in conclusion, I think the one point people give for seeking medical care abroad, especially the people in government, is for confidentiality and privacy. They believe that if they get treated in the local health facilities here, the condition that they're in or whatever they're suffering from will disseminate everywhere. And some people actually prefer to get medical care, and actually their medical conditions are not, you know, told to everybody, because we know as Ugandans, you know, even the local community around, they can easily just, you know, get information about you. Yeah, exactly. Start rumors that don't even exist. So they will prefer to actually go
And
abroad.
yet in reality, your doctor owes you confidentiality. Ideally, they owe you confidentiality, but you know, people have their reasons.
They do. Okay, I think that was it for today. Thank you very much for tuning in. We are having a medical expo at Umasho grounds from the 7th to the 9th. We urge everybody to come and attend. You are going to come, you're going to get consultations from very many different health experts. You're going to get free screening for different medical illnesses. Bring your mothers, bring your fathers, bring your judges, the children. It's going to be so informative, and I believe 5,000 shillings is a price that, you know, is very subsidiary and, you know, worth it in general. So actually getting a consultation for 5,000 shillings from a different medical experts, not even just one. I think it's actually something that is worth it.
And also learning from experts.
Exactly. Yeah. You get information, things you did not know about. Yeah. So come one, come all. And thank you very much. Until next time.